In your experience, how much of a problem is selling ADHD medications in school?
It seems to be a definite problem in school. I knew many kids my age who sold their prescriptions/shared with friends who did not need it. Problem is kids will abuse anything.
Were you ever offered medication in high school?
Frequently during grades 9 and 10. I did notice a decrease in the prevalence of Ritalin and Dex in senior high, but maybe this was because those kids weren't passing.
Do you think that ADHD medications are overprescribed?
The kids that I knew who were on Ritalin seemed to need it, as they could not focus. It's hard to know if the medications are abused because the children taking them are more prone to substance abuse, having the inability to sit still/focus, or if by simply having the medication on hand leads to abuse due to convenience. I like to think the doctors do a pretty good ADHD assessment before busting out the prescription pad, especially now that there's quite a bit of press surrounding this issue.
How have you experienced them being ingested?
Well, the kids who were abusing the drugs not using the doctor-prescribed dosages-would snort it. I didn't know any kids who would take the drug orally to get high. Snorting seemed to be the preferred route.
In your experience, what effect do ADHD drugs have on normal teens?
They would sometimes sit at their desk and do their homework, but I'm not sure if time management improved. Maybe they just seemed to be doing work. They seemed more productive though. Paranoid thinking was often a side effect as well, and fast talking and elevated mood. There seemed to be a highly addictive component as well, as they would talk about when they were going to get/do more. It became a lunch hour ritual.
What are your thoughts on ADHD medication as gateway drugs?
Teenagers love to experiment. So if you give them a legal drug they've been taking for their whole lives and they are interested in trying drugs, they're going to probably snort the Ritalin. However, they probably will do other drugs too, so we can entirely blame the Ritalin on being a gateway, as the kid has made up his mind that he wants to do drugs. I think maybe the booze just isn't strong enough anymore.
Have you or any of your friends ever been addicted to prescription medication?
Yes, I had probably about 4 friends in my small high school who were addicted to the ADHD medication.
Any final thoughts on the matter of abuse of ADHD medication?
Some kids, in my opinion, do need the medication if they ever want to graduate, go to college, or further their education. ADHD is a real disorder, maybe increasing with our society's lack of attention span. Fast games, fast cars, iPods, iPhones, television, magazines, movies. So if treatment has to be pharmacological and alternative methods do not work, a risk is improper use of the medication. With further patient teaching and further tests to correctly diagnose ADHD, we can ensure we are not overprescribing the medication, and those who do need them fully understand the medication. Spreading awareness about the issue of ADHD medication abuse will ensure the public is aware of its prevalence, and education of teachers about the signs and symptoms of ADHD medication abuse to detect and report it in our school systems.